Hi everybody, Jason here. Going to show you a couple of exercises for those of you who are suffering from ankle pain, more specifically those of you who have been suffering from chronic Achilles pain. So pain right back here in your Achilles tendon, might feel this in your heel as well. First thing I'm going to show you is how to do a self-release to your Achilles tendon and muscles on the bottom of your foot. So what I want you to do is just have a seat somewhere in a chair, couch, floor, wherever, and you're going to cross your involved side over your other leg. Now you don't have to do it like this. You can just keep your legs down and go like lean forward like so. Whatever feels more comfortable for you. I prefer to cross my leg over. And then what you're going to do is take your thumb and index finger. You're going to palpate. You're going to touch. You're going to feel around your Achilles tendon. And what you're feeling for, any kind of tight masses, any kind of ball-like structures that are tender around your Achilles tendon. Now, you don't need to pinch with all your might, but just a little bit of pressure, and it's always a good idea to compare your uninvolved side to see what a normal, uninvolved, unpainful side should feel like, okay? So you go back to your side that's bothering you, thumb and index finger, palpate along, touch along your Achilles tendon. When you find those tight ball-like structures, you're going to take that thumb and index finger and you're just going to hold it there. Now, you don't need to pinch with all your might, just tolerable pressure. It's going to be a little uncomfortable, so don't squeeze super hard. As you're holding that, I want you to take your thumb and index finger and just massage up and down while holding it. You could do little circles, and you're just going to do this for maybe 5 minutes or so. You don't need to spend 10, 15, 20 minutes on it. I would say maybe 5 minutes. It's a small area. Now, you can do this periodically throughout the day, though. Okay, and what we're going for is just a release in that area, little massage, light, tolerable, sustained pressure to that area. About 5 minutes, do it periodically throughout the day. Also, on the bottom of your foot here, if you just go right in the center of your foot, right towards the arch of your foot, if you just put a little bit of pressure right in the center and you kind of push down towards the floor, there's muscles that lie underneath what's called your plantar fascia, which I'm sure you all have heard of. There's two main muscles underneath there that are commonly tight if you have heel pain or if you have plantar fasciitis, tight pain. So take your thumb, just a little bit of pressure into your foot and a little bit down towards the floor. This can sometimes be a sensitive area, so again, don't take your thumb and jam it in there. If there's something tight and irritated, it'll tell you when you get on it. And again, it's always a good idea to feel your uninvolved side to see what it should feel like. Same kind of thing in terms of time. If you have a tight, tender spot kind of in the center of your foot, just tolerable pressure. Don't jam your thumb. Don't jab it into your foot. Just tolerable pressure. Hold it for about 5 minutes or so. You could do a little circles, little back and forth motions with it. Give it about 5 minutes and do it periodically throughout the day. Next, in terms of strengthening, you're going to stay in a seated position. And what you can do is you can just lean on your involved side. So you're putting a little bit of pressure through your leg, through your knee here. And you're just going to do a seated heel raise. So you have two main muscles in the back of your lower leg here, your calf, commonly referred to as your gastrocsoleus complex. Yes, you have other muscles back there, but for the sake of this video, we're honing in on what's called your soleus muscle with this exercise, which is a smaller endurance-based muscle that helps you raise your heel up. So lean forward, little pressure through your leg, do a heel raise, and I want you to hold that for a good 10 to 15 seconds, and then relax, and I want you to try 2 rounds, 2 sets of about 15 to 20 reps, holding for about 10 seconds. Now, if you have heavier weights, you can set that right on top of your leg as well. If you have like a 5-pound weight or so, that's probably not enough. You know, you're looking somewhere around like 15 to 20 pounds. But again, kind of trial and error. If you have a 15-pound weight and you try it and you can't quite hold it that long, no big deal. Try a lighter weight, or you could just put some pressure by yourself just by leaning forward. 10-second hold, 2 rounds of about 15 to 20 for about a 10-second hold. Lastly, you're going to stand up, and I'm going to turn to the side so you can see me here. And what you're going to do is you're going to do just a standing heel raise on both sides. Always a good idea to keep your hand next to a countertop for support or a couch just so you don't fall over, just help with your balance. But you're going to go up on both sides, and then whatever your involved side is, so in this case it's my left side, you're going to lift your other leg. So you're going to lift your right leg and you're going to slowly come down on that involved side. So I'm going to turn around so you can see me better. But again, that's up on both legs and then down only on the leg that's bothering you. So again, for this video, it's my left side. So let me turn so you can see that better. So that's up on both. Lift the leg that does not bother you, lift that off the ground, and slowly come down on the leg that does bother you. Up on both, down on just the leg that bothers you. And I want you to try 2 sets of about 15 to 20 reps of those. Give those exercises a shot. Hopefully this helps you out. Thanks, everybody.